On this edition for Saturday, June 27th, a surge in new coronavirus cases across the country, the reality of fast-tracking a vaccine for COVID-19, and in our signature story, the dream of home ownership lost for many low-income people trapped in rent-to-own contracts. Next on PBS NewsHour Weekend.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wachenheim III, the Cheryl and Philip Milstein family, the JPB Foundation, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments. Additional support has been provided by Consumer Cellular and by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
Good evening and thank you for joining us. A new surge in COVID-19 cases continues today in several states from California to Texas and Florida. At least 6 states reported their largest single-day increase yesterday since the pandemic began, according to a New York Times database. The number of COVID-19 cases is nearing 2.5 million in the United States, and the national death toll is now more than 125,000 people. The Centers for Disease Control and Prevention reported the number of new cases nationally set records for the past 3 days. 2 states, Texas and Florida, are changing course and reversing reopening decisions. In Florida, more than 9,500 new cases of COVID-19 were reported this morning. For more about Florida's response, I spoke with Ben Konark, who covers healthcare for the Miami Herald earlier today. Ben, where is Florida now in responding to the surge in coronavirus cases?
I think it's really we're starting to see the state respond now. A lot of their response earlier was focused on nursing homes, protecting the elderly, and focused on reopening. And we did a project here at the Miami Herald that looked at what we could see in the data as the state was reopening. And what we found was that we didn't really meet these criteria that the CDC recommended when we reopened. Public health experts were concerned at the time. And then there was a month or so where it was pretty muted, I would say, as far as the case numbers. Down here in South Florida, we always had a lot. But in other parts of the state, it was pretty quiet until very recently.
You're in Miami-Dade County. 4th of July is coming up. What are the plans?
Well, the county mayor here just announced that they're going to be closing all the beaches for July 4th weekend. So everyone found that out late last night. That was after a dramatic increase in the case number statewide. We saw nearly 9,000 cases yesterday, which dwarfs anything we had seen before that. So there was a lot of tension that had been building up over the last week. We were seeing these cases jump, and everyone was kind of wondering how bad it was going to get. We still don't know that. The numbers we saw yesterday, the numbers we saw the day before that, really reflect infections that started affecting people, a week or more ago. You don't only have the lag for getting a test result, but then you have a lag when the state processes that test result. So you really have to look at it 1 week at a time, and the last week was certainly an alarming one.
And how easy is it to get the information from the health department or the state? How transparent is the process? How kind of real time are you accessing all the numbers in Florida?
Yeah, so I wouldn't speak for all journalists, but I think I can speak for most journalists when I say it's been a frustrating experience getting information from the health department and the governor's office. Our newspaper, the Miami Herald, has had to sue the state to get information on nursing homes, and we were able to succeed with that. So it's been an ongoing process. Now, the state does release a lot of data, but that shifts around. It's always a moving target. And when the metrics start to look bad, we're told to focus on something else.
And now at the same time, Miami-Dade County is seeing an increase in West Nile virus cases as well.
Yeah, that is, that's not uncommon down here, but that is absolutely concerning. I mean, mosquitoes are very omnipresent in Miami. There's been Zika down here before. We're seeing dengue already down in the Keys. This is a tropical climate, and there are a lot of infectious diseases here. And that also brings me to hurricanes. we're entering hurricane season, which is always, even in a normal year, it's a challenge for Florida. And Florida's gotten really good at preparing and responding to hurricanes, but we've never done it during a pandemic. Or I guess we have like a century ago, but it's been a while. So it's going to be interesting to see. And I think it's a concern for a lot of public health experts that given how much transmission there is, sheltering people in gyms in closed confined places could be really bad.
All right, Ben Konar from the Miami Herald. Thanks so much.
Thanks for having me.
The global COVID-19 pandemic is also continuing to rise in other countries. India reported its biggest single-day spike today with more than 18,000 new coronavirus cases, bringing the total there to more than 500,000. Cases are surging in the capital, New Delhi, where government workers are conducting a door-to-door survey to try to map the spread of the virus. And the European Union is close to finalizing a list of countries whose citizens will be allowed to enter Europe starting next week. EU diplomats confirmed today that citizens from countries with high rates of COVID-19, such as the United States, are not likely to be allowed to enter. A federal judge in Los Angeles ordered the release of migrant children held in the country's 3 family detention centers late yesterday, citing the severity of the coronavirus pandemic. U.S. District Court Judge Dolly Gee said the children must be released by July 17th. The order comes after plaintiffs reported that some children in federal custody had tested positive for the virus. In her ruling, the judge criticized the Trump administration's lack of compliance with recommendations from the Centers for Disease Control and Prevention, stressing that there is no more time for half measures. According to the ruling, there are currently 124 children in the 3 detention centers. President Trump signed an executive order yesterday to protect American monuments, memorials, and statues that he says are being targeted by anarchists and left-wing extremists. In the order, Mr. Trump says their selection of targets reveals a deep ignorance of our history. Offering little in the way of new authority, the order instructs federal law enforcement to prosecute those who, quote, damage federal monuments and threatens to withhold federal funding from state and local governments that fail to protect their own public monuments and statues. The order comes after weeks of protests following the death of George Floyd while in Minneapolis police custody and the targeting and toppling of statues and monuments throughout the country honoring those who supported slavery. In some places, statues and monuments are being taken down or moved voluntarily. Today, Princeton University announced it will remove the name of former President Woodrow Wilson from its School of Public and International Affairs and from Wilson College. In a statement, Princeton's president said, quote, Wilson's racism was significant and consequential, even by the standards of his own time. Today marks Global Pride Day, and while many parades and in-person celebrations were canceled due to COVID-19, there were both virtual and public events today. In London, activists wearing masks marched to mark the 50th anniversary of one of the city's first Pride parades. In Berlin today, crowds gathered to celebrate both Pride and Black Lives Matter. Live-streamed events are replacing many of the traditional events, including tomorrow's New York City Pride Parade on the 50th anniversary of the first march there. With new coronavirus cases at a record high, the race for a COVID-19 vaccine is setting a record pace. But finding a vaccine and making it through the various stages for approval are 2 different things. I recently spoke with ProPublica reporter Caroline Chen about the ambitious timeline and unpredictability of clinical trials. At this point, there seems to be a lot of optimism for people to say, you know what, life is going to get back to normal when I get a shot in the arm, when there's an approved vaccine. I've heard it's just around the corner, but you talk to a lot of experts and it's not going to be that simple.
I did talk to a lot of experts, and there is optimism that we will eventually have a vaccine for the coronavirus. There might have to be some managing of expectations over how soon exactly that will be. The trials will take however long they will take to run. And I asked a lot of people, what are you unwilling to compromise on? And what all the experts said to me is, we don't want to compromise on that phase 3 trial.
The phase 3 trial is where we have a very large population, thousands of people take it at the same time. Some get the vaccine, some don't get the vaccine, and then you kind of wait to see what goes possibly wrong.
So the phase 3 trial is exactly what you said. It is a large trial. So the first one that's going to happen in the US with the Moderna vaccine is planned to be 30,000 people, half get the vaccine, half get the placebo. And then you just wait and see how many people get sick in the vaccine arm versus the placebo arm. And all this time you're tracking to see and monitor to make sure that there are no dangerous side effects. That's really important. You want to see what happens and see how many people get sick in the vaccine arm versus the placebo arm and compare those numbers.
One of the things that people are confused by is, well, if there's not an approved vaccine yet, I've also heard that there are companies already manufacturing vaccine. I mean, is that to try to address this idea that even when one is approved, not everybody's going to have access to it right away?
So typically what happens in non-pandemic times is that a manufacturer will only make just enough vaccine as they need to run a clinical trial. So what's happening now is they are starting to mass manufacture even while the trials are starting. And so this could potentially mean that you're going to waste a whole lot of vaccine, because if you run the trial and it's not successful, you're just going to have to throw it all away. But if a trial is successful, the minute that the trial is completed, we can have millions of doses on hand. But at the same time, I think we should still be clear that millions of doses on hand is not going to be billions of doses on hand. So we're still not going to have sort of this, one glorious day where the vaccine is approved and every single person on the planet can immediately get their shot that single day.
How is the coronavirus vaccine that we might come up with different than the flu vaccines, which have different levels of efficacy year after year?
There is one lucky break that coronavirus vaccine manufacturers have had so far, which is so far the spike protein, which is the part that engages with the human cell. Our understanding is that that part hasn't mutated much at all. So if that's the part that you're really making the vaccine for, that's the key part, and it hasn't changed a lot. Our expectation is that if we make a successful vaccine for that part, it should likely work.
The administration says they have this warp speed program and they hope to have something up and running by January of next year. The experts you spoke to, is that accurate? Is that optimistic?
I think the most optimistic people I talked to said it is possible that we will have some vaccine by the end of the year, if everything goes well. We could have a few million doses by the end of the year, which can be prioritized to the people who need it most. And then for the rest of us, we're going to have to wait for 2021, and we might have hundreds of millions of doses sometime in 2021. This is in the best case scenario timeline where the trials all work. There are other people who said to me, I hate overpromising. So I talked to Dr. William Schaffner, who's a longtime vaccine expert, and he just said, I hate it when the government overpromises, because then the fear is that we will underdeliver. And he said, I wish the messaging was just, we are working on this as hard as we can, but we have to get this right. And he refused to give me a timeline. So depending on who I talk to, the timeline's varied.
Even best case scenario, even if I get a vaccine sometime next year, how do I know how long it works?
You cannot know by running a phase 3 trial how long somebody will be protected by the vaccine. The only way to know how long protection lasts is to track them over time. Different vaccines that we have on the market today, some of them require booster shots, some of them don't. And so we will not know, and we will have to find out along with the rest of the planet.
If we don't know how good the vaccine is going to be, how long the antibodies are going to last, there's still a bit of uncertainty here.
So Dr. Paul Offit, who is a veteran vaccine scientist, said to me, the proof is in the pudding, and the pudding is the phase 3 trial. So we will get some very concrete answers from the phase 3 trials, which are how safe is the vaccine, at least in a big pool of participants, and how effective is it. So we will get some answers from the phase 3 trial, which will be really important answers. We won't get some answers. We won't get the answers of how durable is the vaccine over many months and many years, for example.
Caroline Chen of ProPublica, thanks so much.
Thanks for having me.
For the latest national and international news on the coronavirus pandemic, visit pbs.org/newshour. This month, the Department of Housing and Urban Development announced that homeowners on the verge of losing their homes due to the coronavirus may now have till the end of August. That's because the agency is extending a moratorium on single-family home foreclosures, which was set to end next week. Still, Housing advocates warn that a foreclosure crisis similar to the one during the Great Recession could be looming. That crisis helped spawn the rent-to-own model. It was marketed as a way to help low-income people who often could not qualify for a mortgage become homeowners. Special correspondent Carla Murthy brings us this report, produced in part before the pandemic. It is part of our ongoing series about poverty and opportunity in America, Chasing the Dream.
In the spring of 2015, Tara Brown went to look at a little bungalow on Pasadena Avenue in Youngstown, Ohio.
And I fell in love with it. Cute little red and white house, and it was like the perfect size for us, and it really didn't seem like it had that much wrong with it.
The house was owned by Vision Property Management, a real estate firm that advertised affordable ways to turn renters into homeowners without a traditional mortgage. Because of bad credit, Brown, a waitress who lives with her boyfriend and their son, never thought owning a home was possible. The contract stated they would have to pay about $450 a month to Vision Property, along with a small down payment. With a household income of $36,000 a year, it seemed doable. Why did you want to own a home?
It was pretty much about settling, making some roots, giving our child someplace he could call home. And we've struggled quite a bit. So for us, it was the American dream for us to actually have this opportunity to get a house. And we were so excited.
But the excitement quickly wore off. The day after they moved in, her boyfriend tried to get the water turned on.
And there was no copper piping in the house. It had been apparently all stripped out of the house. So we kind of panicked. What were we supposed to do?
It took them 6 months to save enough money and put in new pipes. But other issues crept up as well. The electricity in part of the house didn't work. The furnace was broken. But the worst came when the basement flooded with sewage water, and they had to call a plumbing company for help.
And they would not come out because they told us that we were renting our home, and they did not have authorization from Vision Property Management to come into our home and do work.
When they said that you weren't the property owners, what was your reaction?
I was shocked, and I told my boyfriend, I said, you know what, honey? I said, we got to break out our contract. And we were kind of pretty much in a bad situation.
The contract they signed is called a lease with the option to buy, also known as a rent-to-own contract. It essentially treated them like renters, but came with all the responsibilities of homeowners. They had the option to buy the house at a later date, but in the meantime, they were responsible for all repairs, paying previously unpaid utility bills, taxes, insurance, along with the monthly payments, or face eviction. Brown and her boyfriend tried to fix the sewage problem on their own, but the bills started piling up.
I felt like these were all my mistakes that I made, and this was our fault that we're in this situation. This was my home. I was supposed to be excited about this, and I was embarrassed. For me, I felt like I didn't have a choice.
Unable to keep up with the monthly payments, Tara Brown and her family were evicted. All the investment they put into the house was lost.
This same kind of story kept coming up. So
Ian Beniston is the executive director of the Youngstown Neighborhood Development Corporation. YNDC is a nonprofit that helps low-income homeowners with house repairs.
we had received several messages and calls from people saying, I need assistance with my house. But number one, some of them did not fully understand that they did not own their house. They also didn't understand the condition of the property. Others started to see a possible deception in what people were being told as they were led through these types of transactions.
These kinds of rent-to-own transactions, including land contracts and contracts for deed, were originally created to give people who may not qualify for a mortgage the chance to own a home.
So there were not a lot of these transactions in the 70s, 80s, 90s.
Sarah Bowling Mancini is an attorney at the National Consumer Law Center. She says the foreclosure crisis created a new market for rent-to-own contracts because cheap houses were available to buy in bulk.
There were a large number of real estate owned properties that were available post-foreclosure, and not a lot of qualified buyers who could obtain a mortgage loan because banks really constricted access to credit during that time period. And in order to draw a stream of income from those properties, they decided to market these properties as rent-to-own opportunities.
What is known about how prevalent these kinds of contracts are nationally?
So these transactions really operate under the radar, and it's very difficult to quantify.
She says that's because most states don't keep track of these types of transactions. But she points to research that identified at least 25,000 homes purchased by large real estate companies using the rent-to-own business model, including Vision Property. And these homes were concentrated in areas hit hard by the foreclosure crisis, like Youngstown, Ohio.
These are properties that would have been owned by some of the
YNDC began tracking down houses owned by Vision Property Management, which is headquartered in South Carolina. They sent letters to those homes and put information out in the local media.
That resulted in more folks coming forward. And
Beniston referred those folks to Community Legal Aid, a nonprofit law firm that serves low-income people. In 2018, Legal Aid filed a lawsuit against Vision on behalf of 10 residents, alleging the company engaged in a pattern of corrupt activities.
They had a scheme in place to take advantage of people.
Steve McGarity is the executive director at Legal Aid. He says many of his clients were told the houses were livable and the purchase prices were often grossly inflated.
They had to bring it up to code to live in there.
McGarity and his colleague took me to one house owned by Vision that was so deteriorated it was bulldozed by the city soon after his client got the property.
How you could sell somebody a property knowing, and take their money, knowing that the house is condemned. I mean, it's just completely illegal.
You know, what do you say to those people who say they should have read it in the contract? It was in the contract.
Absolutely. And what I say is that there's all sorts of protections in place when someone tries to buy a home legitimately. They make sure that they get a home inspection lined up. Most people are not paying cash for properties, and so they're going to get a mortgage. And you can't get a mortgage from a bank unless the bank gets an appraiser. And so these are protections that stop that potential purchaser from getting a bad deal. None of that happened in this case. These people.
McGarity believes these contracts were built to fail. One long-term study out of the University of Texas looked at these contracts in 8 counties there and showed that only 20% actually end up in home ownership. Outside of Youngstown, Vision has been the subject of numerous lawsuits by state regulators for deceptive practices, including Wisconsin, Pennsylvania, and New York State.
We did not realize that there were other people out there like us.
Tara Brown and her boyfriend joined the lawsuit after reading about it in the local newspaper.
It made me question, you know what, maybe I wasn't wrong. Maybe I didn't do anything wrong.
In December of last year, Vision Property Management settled the lawsuit in Youngstown. Although the company did not admit to any wrongdoing, they paid the plaintiffs amounts ranging from $5,000 to $25,000.
You know, these are low-income people who don't have savings in the bank. It was life-changing for them. I mean, to be able to get that money back.
FTE Networks, a technology company, recently acquired Vision Property Management in a $350 million deal. In a statement to NewsHour Weekend, the company said it, quote, does not comment on specific litigation, but that FTE has begun the process to exit the lease-to-own model. Some municipalities, including Youngstown, have passed ordinances to protect residents in the future, for instance, by requiring home inspections and appraisals in these types of land transactions.
So there are policy solutions that would stop this practice in its tracks.
But without comprehensive regulation, Sarah Mancini worries about the future.
The coronavirus epidemic and the economic hardships that homeowners are facing will likely lead to a wave of foreclosures. And if that happens, it will lead to another surge in homes that are not accessible to people who cannot obtain a mortgage loan to buy them. So there's a grave risk that we could see the same history repeat itself in the very near term.
Finally tonight, Milton Glaser, the graphic designer who put the heart in the now iconic I Love New York logo he created, died yesterday. Glaser did the design for free in 1977 as part of an ad campaign to boost the state's image. A native of New York City, Glaser began his career in the 1950s and became known for his use of bright colors and exaggerated, flattened forms in everything from ad campaigns to book covers to redesigns of restaurants. His image of Bob Dylan, included as a poster in the 1967 album Bob Dylan's Greatest Hits, remains one of the era's most reproduced images. Milton Glaser died on his 91st birthday in New York City. That's all for this edition of PBS NewsHour Weekend. For the latest news updates, visit pbs.org/newshour. I'm Hari Srinivasan. Thanks for watching. Stay healthy and have a good night.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wachenheim III, the Cheryl and Philip Milstein family, the JPB Foundation, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments.
For 25 years, Consumer Cellular's goal has been to provide wireless service that helps people communicate and connect. We offer a variety of no-contract plans, and our U.S.-based customer service team can help find one that fits you. To learn more, visit consumercellular.tv.
Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.